CTOs, which stands for chronic total occlusions, are the most difficult cases that we tackle in everyday practice of interventional cardiology. So in a scale of 0 to 10, this is like almost an 11 or a 12. These are the most difficult. You have to be an expert to do them at a high level. I think that the most important thing in any complication is to prevent them. So being very methodical, practicing very careful what you do, studying the angiogram and the patient, taking into consideration all the details is key. Once they occur, then depending upon what the problem is, then you have to be able to deal with it. And because they're so complicated and so complex, I think that it should be done only by very experienced operators. And part of it is not only to have high success rate, but they should be able to manage complications should they occur.
So is this field, can we improve even more with the equipment, the technology? How can we say that we will reach a point that we can improve at the best the patient's life?
Well, there's always room for improvement, both in the way we do the cases, the techniques that we use, but also in equipment and new gear. I think that still it's not ready for every interventionalist to perform these cases. So a big part is going to be education, and we need to broaden actually the number of physicians that can actually perform them. And we've been very active throughout the years, both in the United States where I practice, but also in Europe. And this meeting here is part of this effort to introduce the basic concepts of CTO-PCI and also to teach other physicians how to do it. We also need, you asked me how can we improve further our patients' lives. I think that we need more data so that we can select the appropriate patients for this procedure. As in every field of medicine, the key thing is to select very carefully the patient that is most likely to benefit out of the procedure. And I think that we need much more data on that.